Meet Bonati Spine Institute guest, Rendee Hughes.
I live in Lithia, Florida. I'm a commercial realtor in Eastern Hillsborough County, and for fun we like to do museums and movies and just physically walk, go around and keep moving.
Despite having an active lifestyle, she suffered with pain for a large portion of her life.
My pain has been an ongoing thing for 23 years. When I had my son in 1996, I had a bad epidural, and he had to redo it. And I believe when I went back to the gym after I started working out, I had lower back pain. Trying to get the baby weight off was hard, so I worked out harder, and I ended up blowing out a couple of my discs with weight training. It was hard to function, and it was hard to be a good mama, especially it was a Christmas that I had gotten out of bed and I had fallen on the floor and I couldn't get up. And then when we got to the doctor, they were shooting me full of morphine just to get me up. When it came on really hard. It was just hard to get on the ground with them, and hard to play with them, and hard to really just be involved as I'd like to be. It was hard to drive because in fact, the car I got right now is equipped such that it doesn't hurt my back. I specifically went for a higher car so I could get in and out and not have to squat or bend. I used to walk 3-4 miles a day, and I couldn't do that either. It just really took away my quality of life.
Rendee has degenerative disc disease, a term used to describe deteriorative changes in the spinal discs as we age. In 2002, she opted to undergo a traditional spine surgery.
The degenerative disc pain started slowly. It was more like just an aggravating nagging when I would exert myself at all. And then over time, it became more of a stabbing and radiating pain throughout my hips and in my lower legs. I would wait until I was dragging my leg before I went to surgery because I didn't want to go under the knife. What prompted me to go initially to the original surgery was I had heard from one of my friends that this doctor was really good. He told me, I don't want to operate on you unless that's the last thing we can do. So for many years, I was doing different therapies and different pain management techniques, but I didn't want to do the drugs. The drugs just don't agree with me, and I don't like the whole side effect anyway. And then eventually, I couldn't function. I was dragging my leg and couldn't get up, and I said, well, I guess it's time now to do something about this. I believe the surgery was a discectomy in which he cut probably a 2 or 3 inch, incision in the back. It took me almost 8 weeks to recover from that. He did have me up and around walking 20 minutes a day. It was very challenging to do it, but it was part of my rehabilitation. But it was a struggle to really get back on my feet again after I had the surgery.
Rendee felt only slight relief after this surgery, and in the years following, her pain redeveloped.
One of the things I was very against was the wanting to continue to prescribe pain medication. I just didn't feel really good with pain medication, so I've done other things, like I was going to a chiropractor. I had hired a personal trainer to help me with my back. I had massage therapy. I had started acupuncture. I was really trying hard not to go on narcotics because to me, it's just masking the problem. It's not actually solving it. One of the reasons I looked at Dr. Bonati was that there seemed to be a different solution to solving my back problem instead of a back fusion. I have seen multiple surgeons who continue to tell me that the only way I can recover is by fusing my back. And I don't like the odds of a back fusion actually working. I've talked to some people who do great with it. I've talked to some people that really are worse after they're done. So I wanted to look for someone different and somebody who might be able to at least help me not have to get that fusion or delay it, or maybe not have it at all. That's what led me to look for other alternatives. I did look at one of Dr. Bonati's competitors, and I did actually go to one of Dr. Bonati's competitors, and he told me that he couldn't work on me. So I decided to go see Dr. Bonati himself because I understood that he was the one that started it all. The medical experience I got at Bonati was like nothing I'd ever seen before. When you asked a question, they would answer. When you had an issue, they would come and help you, and they would explain things, which I've never had before. I basically have had people tell me, well, you need this, but they never really gave me a reason why. The Bonati Institute has their own little imaging center, which is great. You get immediate results. They do the x-rays on site, they do the MRIs on site. So it's something that you can get an immediate result, which you don't get at the doctors ever.
Rendee's surgical plan called for a treatment at multiple levels. She had 2 procedures in 2016, beginning with the level that caused the most pain, L3, L4.
It was pretty simple. I mean, when we went in to the front desk, They were very specific. They asked me specifically what surgery I was having done. They wanted to see my paperwork. I got to see the nurse. The nurse actually prepped me, and I got to talk to the anesthesiologist, one-on-one. And then I physically actually walked back to the surgery room, which was kind of cool. When I come out of surgery, it was like an immediate relief of the pain. I could actually get up and walk, and part of our therapy was that you'd walk 40 minutes a day, and I would do sections of 5 to 10 minutes at a time, and I could get through them. The pain I had was just the incision pain. It wasn't the back pain anymore. It was pretty amazing. What I really liked about this surgery was I was actually able to go to a hotel afterwards and just relax. I didn't feel the stress or the pressure or really the noise of a traditional hospital. I've always had issue with going to the hospital and staying overnight because you don't really get any rest. It's very loud and very lots going on all the time. So being able to go back to the hotel and just quietly rest was very, very important.
After one final follow-up appointment the morning after the procedure, guests are free to return home to relax and often find that getting back to life is easier than expected.
After the incision pain went away, it was very easy to resume most activities. Of course, you don't want to lift and you don't want to bend too far until after you've healed more, but as far as getting up and walking, that was something I could get back into and work back up to. Getting out of bed was easier, and putting on my shoes were easier, and just things that we all take for granted, that getting in and out of the shower was a piece of cake instead of being a struggle.
One benefit of the Bonati Spine Procedures' incremental approach is surgery is only performed if the guest chooses to do so, based on their pain or discomfort level. It's been 3 years since Rendee's initial Bonati Spine Procedures at L3, L4. Now she's ready to return for work on the next levels of issue, L4, L5, and L5, S1.
Dr. Bonati's process and what he follows feels like that my hip problems could be caused by the underlying back issues. The incremental surgeries are good because the incisions are so small and the recovery time's a lot quicker. It's worth the time to go up and talk to them and see if they could help you. I've talked to many people about the Bonati Center actually, because I know that there's a better way now.